Ever wondered what happens when your doctor suggests an ERCP? Well, it's a fascinating process, one that combines modern technology with medical expertise to diagnose and treat a range of conditions. Endoscopic retrograde cholangiopancreatography, or ERCP, as it's often referred to, is a technique that combines endoscopy and X-ray to examine the bile and pancreatic ducts. These ducts play a crucial role in draining the gallbladder, liver, and pancreas, and a blockage can cause a variety of health issues. Before an ERCP is recommended, a series of non-invasive tests such as blood tests, abdominal ultrasound, Connecticut scan, or MRI are usually conducted. These tests help in identifying the need for an ERCP. The ERCP process is carried out by an endoscopist, a doctor with special training in the use of endoscopes. They examine the bile and pancreatic ducts, looking for any abnormalities such as blockages, irregular tissue, problems with fluid flow, stones, or tumors. If a problem is detected, the endoscopist can perform a procedure to repair or improve the condition, often replacing the need for surgery. Although rarely indicated in children, when required, ERCP is performed by experienced endoscopists in specialized centers. Depending on the patient's condition and complexity of the procedure, ERCP can be performed either as an outpatient procedure or in hospitalized patients. Preparation for an ERCP involves fasting for 6 to 8 hours before the test. This ensures that the stomach is empty, allowing the endoscopist to clearly visualize the area and reducing the risk of vomiting during the procedure. Certain medications might need to be adjusted or stopped prior to the examination, with all medications and dietary supplements discussed with the provider. For instance, if a patient is taking a blood-thinning medication, the provider will determine if and when it should be stopped prior to ERCP. For pregnant women, ERCP is usually postponed until after delivery, unless the procedure is urgent. Lastly, due to the sedative effects of the medications used, patients will need someone to bring them home after the examination. To summarize, ERCP is a powerful diagnostic and therapeutic procedure that allows doctors to examine and treat conditions affecting the bile and pancreatic ducts. The process is carried out by highly trained endoscopists and involves a series of preparatory steps to ensure a successful procedure. So, the next time your doctor mentions ERCP, you'll know exactly what they're talking about.